So in terms of impact, we had been concerned with making sure that our project has real-world impact from the beginning. So I personally was very motivated to make sure that our ideas and what we came up with actually had some sort of influence and change in the world. So the person that I work with, the PI on this project, is a man called Sir Michael Marmot, who is very well known for working on social epidemiology. And around 2008, he was also the chair of the WHO Commission on Social Determinants of Health. And he was also very interested in kind of changing the way that we address health and health inequalities around the world. And so we wanted to make sure that from the beginning we weren't just doing an academic project, but we were doing really good research and science and really good knowledge production, but also change it. And so what we did is that I sort of spent a lot of time trying to both think about where kind of key global health policy is made, and sort of thinking about what's near me and what's sort of distal. So thinking about things like educational institutions within sort of the London and the UK, thinking about foreign policy institutions, whether it be DFID or thinking about Chatham House or something like that. But also thinking, for me, internationally from my connections about different institutions. And I think the other big thing was that at this point, Sir Michael was writing the report with other people, and so that report itself was one of the big stuff, and the follow-on activities from the Commission and the WHO. So very practically, I think what happened is that within London and within the university that I was at UCL, I helped, sort of develop the first kind of course on health, philosophy and justice. So that syllabus was actually, sort of something I helped with, and then I also helped sort of create and teach the first course on global health justice, which was very informed with these kinds of ideas. And then the first conference in which philosophers and social epidemiologists came together to talk about health inequality. So that's a significant event within sort of UCL and within that kind of world. But then you'll see that the WHO has taken up these kinds of ethical arguments that we talk about, but also the conceptual stuff about how it's about the capabilities of people to be healthy. And so you'll see that in the different kinds of stuff. And as time goes on, what I've seen is that different surprising people have taken it up on, and then I sometimes have been really happy that some people have been taken up on. So one of the things that happened almost within 2 or 3 years is that research councils in other countries wanted to expand their research in this area. So I sat on the selection board of the Dutch Research Council, where they were trying to improve and reconceptualize health and health equity. The WHO has very recently I think it was the Global Health or Global Report on Healthy Aging, and the concept of healthy aging is based on this idea of health capability. So I think that's a really good sort of marker of our impact when international health institutions are starting to think about health and capability in this particular way and see it relevance. And I also think that in pure kind of academic world, this has become kind of a marker. Like this is something that you have to kind of recognize when you want to talk about health, equity, justice. So my next kind of phase about this project is that I would like to be able, there's so many beautiful intellectual questions still about this that still need to be done. So one, in a purely sort of as an academic, I'm really raring for the opportunity to build a team of people who can bring together the kind of health sciences and the philosophy. So one of questions like, so if society has a certain pattern of health inequality, what's the right goal that we're trying to achieve? Is it that, philosophers talk about, are we trying to make everyone equal? Are we trying to help the worst off? Are we trying to make sure that everybody comes up to a sufficient standard? So these are all things that we actually have to think through. And these are really important policy questions because when countries and global health policies are aiming for something like universal health coverage, so they're going to have goals. What are we trying to do for something like that? And they're fundamentally based on these kinds of questions about equality, inequality, and that what I said, it's not just about healthcare, it's about sort of making sure that people have capabilities. So there's so many questions that we really need time and space to do. From a real world policy sort of thing, I would like to see the training of medical professionals and health policy professionals and public health professionals try to understand that it's not just a technical concept. This is very much you need to understand the social sciences from the social epidemiology, and you need to learn the ethics. And so what I'd like to see, and one of the things that I've tried to do, is build a graduate program to try to live these kinds of concepts. And I want to see more health professionals, and not even health professionals, people who are interested in doing health policy or doing sort of health work, to kind of understand this stuff. So I guess, you know, I'm not sort of directly interested in like, I want this policy implemented. I'm more looking at the sustainability of this new way of looking and thinking about things. So I think education is really one of the key things. And then these kind of really policy problems that have very conceptual, philosophical basis to it that I'd like to be able to figure out. So I think that's looking for time and space to be able to do those kinds of things.